Topics to be discussed, it seems, or at least it promises to be an interesting session. I have two microphones, so I'll switch this one off. My co-moderator, Dr. Ben Hamouda, arrived very late last night, so unfortunately he couldn't join me, and I'll be handling this on my own. The first presentation, 6-minute presentation by Dr. RASHA HUSSEIN. Professor RASHA HUSSEIN is a dear colleague, and her main interest is MR, and she's going to discuss some new MR protocols with us. Professor RASHA, welcome to the stage. Okay.
Good morning, dear professors and colleagues. It's my pleasure to be here with you. Today we are going to discuss endometrial cancer, Intravoxel incoherent motion diffusion-weighted MRI for assessment of myometrial invasion and tumor grading in adult Egyptian females. This is a co-work was performed with my colleagues, and this is my disclosures. Endometrial cancer is one of the most gynecological malignancy in postmenopausal women, and uterine cancer is the 10th most common women cancer in Egypt. The prognostic factors of endometrial cancer depends on the depth of myometrial invasion, histological type and grade, and also lymphovascular invasion, and the presence or absence of lymph node infiltration. So, MRI is essential in the proper preoperative staging for endometrial cancer, and diffusion-weighted image plays a very important role in improving the evaluation of myometrial invasion, and also it has some role in prediction of tumor grade in endometrial cancer. How diffusion works, it depends on the cellularity of the tissue, when there is less cellular packing of the tissue, there is a free motion of the water molecules between the cells. While when there is a high cellular packing, there is restricted diffusion and the water is limited in its motion. The diffusion principle depends on having two different p-values, and also it is a mono-exponential model, and it depends on the diffusivity of water between the tissues and not depending on the microvasculation. While IVIM principle, it is introduced by Lubihan et al. In 1980s, and it uses multiple low p-values to allow the non-linear bi-exponential model to allow us to evaluate the microvascularity of the tissues as well as the cellular packing of these tissues. And it is helpful in tissue characterization. The IVIM principle depends on having multiple parametric maps, including ADC map and the computed p-value, and also the true diffusion, which is the true diffusion and depending on the cellular packing, the perfusion fraction, which is depending on the microvascularities of the tissue, and also the pseudo-diffusion, which is calculated by this principle. Our aim of work was to investigate the value of IVIM-derived parameters to assess the prediction of endometrial cancer, and also to evaluate tumor grade and evaluate the depth of myometrial invasion. This is our patients and methods. It was performed in a private center in Cairo since 2019 to 2020. And we underwent MRI for 24 female patients with pathologically proved endometrial cancer, and also we performed MRI on 24 control healthy group. The MRI technique needs some preparation, including fasting for 2 to 6 hours before the exam. Kidney function test should be performed because we will inject IV contrast injection. Sometimes we need anesthesia for some patients, and we instruct the patient to evacuate the bladder immediately before the exam to allow the patient to be comfortable during performing the exam. Our technique including putting the patient in a supine position in the MRI machine, and then we perform the dedicated MRI protocol including T2 weighted images in the 3 orthogonal planes, diffusion weighted image, T1 weighted image, and the DCE. And of course, we performed the IVIM including multiple p-values. Actually, we use 10 p-values with more than 5 p-values below 100. And then we performed our analysis. To evaluate the endometrial cancer invasion, we performed the ADC maps for the patient and the control group. The ADC for endometrial cancer appeared to be lower in tumor compared to normal endometrium. Also, the D value and the FP values are lower compared to the normal endometrium. However, we find that there is no any clinical significant correlation between ADC values or D values and the histopathological grading of the tumors. Also, the ROC curves performed showed that there is a very high sensitivity and highly significant comparing the endometrial cancer compared to the myometrium, and this allows us for precise evaluation of the tumor depth invasion into the myometrium. This is one of our cases. This is a 70-year-old female patient with postmenopausal bleeding. This is the T2 weighted image showing a huge endometrial mass filling the endometrial cavity. And this is the axial T2 weighted image showing that there is no appreciable detection that there is more than 50% invasion of the myometrium. Actually, on this T2 alone, we can say that there is less than 50% invasion. However, on the post-contrast image, we notice that there is some abnormalities located over here, and the depth of the invasion is some questionable to be more than 50%. When we performed the routine diffusion and ADC map, this confirmed the presence of haziness at this part of the myometrium compared to the rest of the myometrium, and this was suspicious for having myometrial invasion by more than 50%. When we performed the IVIM map, just 1 minute.
Sorry, for 6 minutes is time down.
This is one slide.
You can continue. Maybe
Okay. This is the ADC map showing the myometrial invasion by more than 50%. And this is the FP fraction map and shows that there is also more than 50% infiltration of the myometrium, and this is the true diffusion map, and this was confirmatory that there is more than 50% infiltration. And the final radiological stage was stage 1B, and it was confirmed histopathologically to be adenocarcinoma grade 2. This is how it looks like in the normal endometrium, with the ADC value is high and the FP value is also high, with high D values for the normal endometrium. So to sum up, diffusion and ADC could be used to discriminate between benign and malignant endometrial lesions, and it has better performance compared to FB values. IVIM has a slight better performance to diagnose myometrial invasion rather than tumor grading. Thank you.
Dr. RASHA, thank you very much. And as always, Dr. RASHA's interest and enthusiasm for MR never seems to fade. So keep it up, Dr. RASHA. And sorry about the interruption. You used 1 extra minute, totally justified, and you deserve more. We'll have, I'm sure there'll be some questions. I definitely have, but we'll keep it till the end of the session. We have Dr. Roa coming to the stage for her presentation today. Dr.